Good evening, everyone. So, good evening, friends and families in Madera and Fresno counties in Senate District number 12. This is Senator Anna Caballero, and I want to thank you for joining me on this informational virtual town hall. I also want to welcome and thank our own Assembly member, Dr. Joaquin Arambula, who will be joining us today and has some brief comments that he'll make at the end. I also want to recognize and thank Samuel Penila, who is translating our town hall meeting tonight into Spanish. And for those of you that are interested in having this broadcast to you in Spanish, there was a different code that that is given so that you can do that, and that code is 544-5219. Para la gente que quiere escuchar todo esto en español, por favor, marque al entrar a la llamada 544-5219 y hay traducción. Muchísimas gracias. So to begin, I want to assure all of you that my first priority is your well-being and that of your family and neighbors, and that I will do everything I can to offer you the kind of leadership and support you need and deserve. I've worked with many of you through some very difficult times. As an Assembly member, I fought alongside many of you for health care coverage for everyone and for clean, affordable drinking water. When I was in Governor Brown's cabinet, California was in the middle of one of the worst economic downturns we had ever faced. I learned firsthand how important it is to have good leadership and good decision-making. And I'm proud to say that together with many of you, we worked hard and turned California's economy around when a lot of people doubted that it could be done. These experiences and many others I've had as a public servant and as an attorney serving farm workers and working families have given me a chance to build on what I learned from my parents, who grew up in a copper mining town in Arizona. There were times of crisis, times when we were fearful and not sure about the future, but I learned and I saw that by coming together, by working together, we could move forward. We could see success. We could help each other and weather the crisis, and I've never forgotten those lessons. Now, more than ever, as I think back on all that I learned from my family and their fellow copper miners, and by all of the brave community members who answered challenges with courage and determination, the heart of any community is how it cares and protects everyone, no matter who you are or where you came from. What all of those lessons boil down to is this: when we are faced with a crisis, we need to stick together. When it's time to make decisions, we need to think and get the facts straight. And when we act, we need to act based on the values we hold dear. So I'll be holding a series of these meetings because I want us to be and to work together during these difficult times, despite the fact that we're in different locations. I want to make sure you have all of the facts and the information you need to understand what's going on. And I want to make sure that we are acting together to protect the families and communities that we all love. So let's jump right into a discussion about the coronavirus, or COVID-19, and the impact it is having in our communities. I have two goals with this town hall. First, to get good information about the coronavirus, what it is, and how it is spread. And for this part, we have Dr. Rais Vohra, Interim Fresno County Public Health Officer, and from Madera County, Dr. Simon Paul, Public Health Officer, and Ms. Sara Bosse, Director of Public Health. They will explain what we know about the virus, how we can avoid getting the virus, what we all need to do, and what to expect, and how their counties are working with the local industries to keep essential workers safe. And the second goal is a call to action. We are going to hear from clinic and hospital managers from Fresno and Madera counties who are working around the clock to get ready to take care of your neighbors who get ill from this virus and need hospitalization. They will answer the question, what should you do if you think you might have the virus? Additionally, they are working to repurpose their facilities to quickly make decisions about who gets tested for the virus, who needs to be admitted to the hospital, and what kind of care they will need. All of this will be new to the staff, the doctors and nurses and support staff who work in the hospital, because no one has treated a patient with this disease before. It is very contagious, and all of the staff live in our community and want to be able to go home to their families when their shift is over. So personal protective equipment, basic hospital supplies like gloves, masks, gowns, and eyewear for frontline healthcare workers is extremely important. At the end of this town hall, I will be asking for donations of this equipment so that we can ensure that there are adequate protection for people who are on the front lines working to reduce this virus. These are our neighbors and family members who do this important and dangerous work. So let's jump right in. Welcome, Dr. Vohra. Thank you for joining us on this call. And Dr. Vohra is the interim Fresno County Public Health Officer. Dr. Vohra, can you tell us what we have learned about this extremely dangerous virus and what we can all do to avoid getting sick and passing it to others? And what does the stay-at-home order mean? Dr. Vohra, are you on the phone? Sounds like maybe he is on a line that doesn't allow him to speak. Why don't we move on to our next speaker, and if we can get Dr. Vohra on the line, we'll make sure that he has a few minutes to speak. Oh, you there, Dr. Vohra? If not, why don't I go ahead and introduce Dr. Simon Paul, who is the Public Health Officer, and with him is Ms. Sara Bosse, who's the Director of the Public Health for Madera County.
Great.
Welcome.
This is Dr. Paul. Can you hear me?
Yes, we can. Thank you.
Perfect. So I wanted to start off just to put things a bit in perspective with the virus. As we all know, the arrival of COVID-19 in our area has led to a lot of anxiety and an awful lot of stress. But the first thing I want to point out is even though it's a new virus, it's a virus. And we already know a huge amount about all different kinds of viruses. And all of that knowledge from other viruses that we've collected over the years is helping us to know what to do as we learn more about the new virus. So like we already know how viruses spread. We know how they make people sick, and we know how people recover. So that's why we know a lot already about how to protect yourself from catching COVID-19. What works to prevent catching a virus like influenza, which we know all about for years, should also work for protecting yourself from COVID-19. Maybe it won't work quite as well. Maybe we're going to have to fine-tune things about how we protect ourselves as we learn more about COVID-19. And I think that's one thing that Dr. Vohra is planning to be talking about. But again, this isn't something completely unknown. COVID-19 is a virus, and that's like other viruses that over the past we've learned to manage and learn to deal with. So what happens when you catch COVID? Well, again, it's a virus like other viruses. If you're exposed, usually 3 to 7 days later, you get sick. And what symptoms are you going to get when you catch a virus? It's the same as like with the flu. You get fever, you get cough, you get muscle aches, and you can get short of breath. So again, like with other viruses, what do you do if this happens? It's the same advice. You rest, you take fluids, you take Tylenol if you're having fevers, and you stay home unless you're sick enough that you need to be coming to the hospital. And most people get better after a week or so. So that sounds fine, but why is this new virus such a big deal, and why are we all staying home? Why is it having so much of an impact if this is true? So one big problem is that since it's a new virus, none of the population, none of us has immunity to it. Anyone can get sick. And the people who get the sickest are those who are already frail. It's our older citizens, it's people with diabetes or other medical problems. And this is different from influenza, where sometimes older people may have built up immunity over the years. They might have some protection from it. With COVID-19, none of us has protection from it. Another problem is, yes, it spreads similarly to influenza, but it may be somewhat more contagious than the usual flu. So you have to be extra careful with the things that you might do to prevent flu. You have to be extra careful with things like washing your hands, and extra careful about staying home if you're ill. You do that for the flu, right? But now you have to be compulsive, sort of obsessive about doing things like that to keep yourself from getting sick. The other problem with this virus is that, yes, it appears it can be more severe. You know, some people get very sick with pneumonia. If you're getting short of breath, you may even need to be in the hospital. And since, as I already said, none of us has immunity, a big problem is a whole lot of people can get sick at the same time. More people in hospitals are used to having sick at the same time. And that's one of the big problems you see in areas like New York. It's not that people don't know how to manage this illness. It's that so many people got sick all at the same time. And I think the hospital staff are going to be talking about that also later on this call. So again, to back up a bit, just to put it in perspective, we know how to protect ourselves from viruses, and we know who's at most at risk, the elderly and people with other medical conditions. But young people can get very sick from this too. So yes, you want to protect yourself, and Sara Bosse is going to be talking about that soon just after me, not just because you don't want yourself to get sick, but also because you don't want any of your friends or your family to get sick, especially if they're elderly or frail. So even if you get better in a week, someone else could end up very sick and end up in the hospital. So that's kind of my overview. Again, it's a new virus, but still it's a virus, something that we know an awful lot about and we keep learning more about. We know how to make medicines and vaccines for viruses. We just have to do that for this one. And we know how to protect ourselves and our loved ones from viruses. And that part, actually, I'm going to be handing off to the next speakers. But again, if you keep it in perspective, this is like influenza. It may be easier to catch. It may be more severe more often. But again, it's not something that's completely mysterious that we have no understanding of. And I think keeping that in mind helps people realize we've dealt with viruses before, and we'll figure out a way to manage people's health through this crisis as well.
That's great. Thank you, Dr. Paul. Ms. Bosse?
Hello, I'm Sara Bosse, Public Health Director for Madera County. And I'd like to talk with everyone about what they can do and what's within their power to help themselves, their family, and everyone around them to stay well. Many of these messages will feel very familiar if you've tuned in to other media, the news, if you're watching things that are coming out from Madera County, Fresno County, where you reside. The first message is to stay home. As we all know, the governor and the state health officer have ordered us to stay home except for essential business, and to also put into practice important tools. So the first is social distancing. I think sometimes that can feel confusing. Social distancing means that we're not gathering in groups of people. And in general, if we do need to gather for essential business, that we're staying apart from one another. And the rule is 6 feet. And so I'm not very good at judging distance in general. And so the easiest way to do that is if both people put their arms straight out and towards one another, your fingers shouldn't touch. And so that'll be about 6 feet from one another. And so it's basically your personal bubble. If you put your hands out and turn in a circle, you shouldn't be closer to other people than that space, except when you're in your own home with your family. And so essential business is important to understand, too. And so there's lots of information out about essential business, but it's basically what do you need to do to meet your very critical needs, the things to keep your family fed and well taken care of in your home. And so I think it's important for everyone to ask important questions about, do I really need this to be able to continue living at home? And also, are there ways in which I could access this without having to leave my home? Maybe there are ways we could have it delivered, resources like Instacart or, delivery of your prescriptions and things like that. And so not every area has those resources, but where they are available, we encourage people to use them if they have that opportunity. Then when people go out for essential business, we want them to go out and then return quickly. Don't linger in stores. Typically for essential business, those critical needs, we know what we need. So make a list, head into whatever that business is, grab the things that you need, head to the checkout, and right back home. The second message is to stay well. We want everyone to be practicing those important techniques that Dr. Paul talked about. So washing your hands frequently, avoid touching your face, your eyes, your nose, your mouth, and then also cleaning surfaces regularly. We also want you to be monitoring for symptoms. So symptoms of COVID-19 include fever, but if you don't have a thermometer, that's okay. If you're feeling feverish, then that might be an indication, and you definitely want to stay home. But a fever, a feeling of chills, a new or worsening cough, and a new or worsening shortness of breath. If you have any of those symptoms, we want you to stay home and then also isolate yourself from the rest of the people in your household. So find a room in your home in which you can be comfortable to recuperate. And if you have help, to be able to have people bring you the food that you need, water, and other things, that would be great. And so if for some reason that you're not able to isolate, or if you're going out even for just essential business, we have provided guidance about wearing masks. And I won't go into a lot of detail about that, but you can go to www.maderacounty.com/COVID-19. And on the main page, if you scroll down a little bit, there'll be a tab that you can click about masks. And you can read about our guidance with regards to masks. And there are a couple links there for the best kind of homemade cloth masks that we recommend. They need to have 4 layers in order to have any level of protection. So, also with isolating with symptoms, if you do get to the point that you need medical care, it's really important to call ahead. Talk to your primary care doctor, or if it's urgent, talking to the hospital and giving them a heads up. So even if you're calling 911, it's really an emergency. You want to let people know that you're experiencing symptoms of COVID-19 because if it's someone in the ambulance, they're going to use masking and personal protective equipment so that they don't catch that while they're providing you medical care. And the same with the hospital clinic or the hospital. They're going to give you instructions about where to arrive at the hospital and where to go so that you're not exposing others. The third message is to stay connected. We know in this time everyone is feeling anxious, and we want to make sure that while we're physically distancing from each other and we're staying in our homes, that we are staying connected with using calls, text, email to encourage one another, to check on other people's needs and make sure if anyone needs any help that we're providing help in terms of connecting them with services. And we want everyone to be taking care of their emotional health. We know that there are people in our community that have already had experiences with COVID-19. And in our own Madera County, we've had now 2 people who have died as a result of COVID-19. Those were individuals that were in vulnerable populations, but one of those, their family members really want to share with the community what it's like and what their experience is, to encourage people to take this seriously, that there are steps that we can take that are within our control to really slow the spread of disease and protect one another as a community. And so 2 of the daughters of the individuals passed away have reached out to us, and we've interviewed them. One interview is going to be in English and another in Spanish to share what their experience was. And so we're going to be releasing those in segments. They're very long interviews. We want them to be able to tell their whole story, and it's going to be released on our Facebook page over the next week. So we encourage people to check in with that, to learn about what their experience is and why this illness is something that we do need to take seriously, but also to understand that there are real steps that we have within our control to protect ourselves, our family, and the community around us.
Thank you for that. That was really thorough. There are a couple of questions, and one of them has to do with the masks. That, at one time, people were told they didn't need to wear masks, and that it appears as if that's changing. Is it based on what we're learning about the disease, or is it just that it's been rethought, or why the change, I guess?
Yeah, I can take that one. But I think the biggest reason is what's become clear in the last few weeks is that people can spread the virus for a few days before they get symptoms. So we've always recommended masks if people have a cough or are sneezing a lot because it prevents them spreading the virus to somebody else. But if you are able to spread the virus before you get the cough and the sniffles, you need a mask on before you have symptoms. So the problem is that there's a lot of people who could be catching COVID-19. There could be people unknowingly spreading it, and it would be good to have a mask on them. And we can't know who those people are because they don't have symptoms yet. So in a sense, it's not a big change. We've always recommended wear a mask to prevent spreading it, but we used to know who needed a mask because they had symptoms, whereas if people don't have symptoms, well, people need to wear masks. So the thing to remember is you're really wearing the mask in case you're catching this so you don't spread it to somebody else. You're not really wearing it to protect yourself. To protect yourself is what we were talking about before, the social distancing, the staying at home, because the mask is not that effective at preventing you yourself from catching it, it's more effective at preventing you from spreading it to somebody else if you're getting sick. So it's kind of the same reasoning, but because there's concern for asymptomatic spread, the people who we recommend wearing it is really, really broadened to basically possibly everyone when you're going out in the community.
I see. Well, that's really good information. It's to protect others, not necessarily yourself. That's great.
Right. So don't use the mask and not do the other behaviors.
Right. The mask doesn't then mean you can have a party, right? I mean, that's you still want to keep your distance. And then there was a question about young children, in particular, what the susceptibility is for young children under the age of 5, and whether there's been mortalities in that age category. I haven't seen anything on this, so I'm not sure if you have any data on this.
Not a lot. It's very mysterious. Young people, usually very young children, are more susceptible to things like influenza, and there have been a few cases, but it's in the single digits, I think, of mortality in very young or infant age people. So we're not seeing what you'd expect with influenza, where there's a lot of young people getting sick. They still can, and we're still very concerned about protecting them, but we have not seen them being a high-risk group, which is often the case with young people. So really the highest-risk people are the elderly, over 60 or 70, and with pre-existing conditions.
Okay. And then is there any guidance in terms of the daycare facilities that will be affected or closed down, specifically regarding essential workers needing childcare?
Yeah, there is specific guidance for childcare, and basically it's do all of these things, cleaning, separating, hand washing, as much as you can to really try and protect children.
But there's no advisement, at least at this point, in terms of. I think the asker of the question is a essential worker and may be concerned about whether there's going to be daycare into the future for them because they are essential workers.
Yeah, it's a decision like childcare places need to make. Can they carry out all these behaviors to protect the kids, right? So obviously you need to be cleaning the place frequently, multiple times a day, and you have to be able to help the kids. And if they're very young children, you have to have, protective equipment so there's no chance of spreading disease if you're changing diapers and things like that. So there is guidance out there for child care facilities, and it's basically just have to be extremely compulsive about the behaviors we know that prevent the spread of virus. Child care places normally do anyway, but it's sort of an extra level of care to make sure that the virus isn't spreading within the child care. Fortunately, again, children, smaller, younger children are at lower risk for getting sick. But if they did get sick, they could bring the virus home and spread it to the adults who might be at higher risk or grandparents. Right.
Thank you. Well, thank you very much. Those are the questions that we had for you. I appreciate your participation and the great information that you provided. Dr. Rais Vohra, I understand that you're on the phone. Dr. Vohra is the interim Fresno County Public Health Officer. And welcome. And Dr. Vohra, if you could tell us what you're working on in terms of the COVID, what you've learned, what the county is doing, what people should do to avoid getting sick, and just as importantly, what's the strategy for testing? We got a lot of questions around testing and where those testing locations are likely to be and who can get tested. I guess Dr. Vohra isn't on the line anymore. Okay. Going once, going twice. So we'll move on to Dr. Leonel Apodaca, who is the Coalinga Valley Health, who is the director of the Coalinga Valley Health Clinic. Dr. Apodaca, thank you for taking the time to join this town hall. If you could tell us what you've done to prepare for the coronavirus outbreak, please share what preparations have been made at your clinic, and if there are differences between your experience and some of the larger hospital and bigger cities, and whether you're experiencing any unique challenges in terms of how you're seeing your regular patients and how you're trying to protect your regular patients from those that maybe have issues with COVID-19.
Yes, thank you for inviting me. We are a rural health clinic in Coalinga. We practice internal medicine and family practice. We see adults and pediatrics. We are affiliated with the Coalinga Regional Medical Center, which is closed at this time, but is in the process of reopening possibly by next week. As it is, we don't have ER services or labs or x-rays available. And so we have 3 other clinics in town, including myself, my own, where we see and treat patients. Our office, our lobby has been separated into a sick lobby and a well patient lobby. Each side has their own bathrooms. The chairs are separated so patients can only sit in every other seat. We have no magazines in the lobby or waiting room where germs can be transmitted from handling of magazines by different patients. Our receptionists are very well equipped to triage and screen patients. We screen patients from phone calls, which we encourage, to screening when they come into the office. We are checking to see if the patient is symptomatic or not. If they are not, we recommend practicing social distancing, frequent hand washing, cleaning high-touch areas. We also recommend, as Dr. Simon said about viruses, treating the symptoms, everything from stuffy nose to runny nose, dry cough, moist cough, sore throats, fevers, muscle aches, itchy, watery eyes, sneezing, earaches, and recommending the home remedies and over-the-counter preparations, including decongestants, antihistamines, cough suppressants, analgesics, pain relievers, etc. If we have a patient that we suspect has symptoms of fevers, aches, cough, shortness of breath, we then assess if they have been in a high-risk area. Have they been in close contact with a COVID-19 suspect or confirmed patient? Other patients that we have a higher suspicion would be a healthcare worker, a first responder, someone who is an employee of a long-term care facility, someone over 65, if their comorbidities include hypertension, diabetes, chronic kidney or liver disease, if they're immunocompromised, have they recently been hospitalized, or do they live or work in shelters, jails, or congregate settings? If that patient has fever or respiratory illnesses with no other high-risk features, we recommend 3 to 4 days of bed rest and hydration, self-isolating, quarantining for 14 days, possibly returning to work when there are no more symptoms. If we have a patient who is high-risk, then we recommend a flu and COVID test. I will give an example of a patient who is a healthcare worker, an RN, who tested positive for the flu in February, wanted to be tested positive again in March for the flu. I had good communication with Marcella and Serena at the public health departments who helped me with this patient and procured a COVID testing kit so we could test the patient. Ended up testing negative after everything, which we were relieved and the patient was relieved. We have not had any positive tests. If we suspect the patient is high risk, like I said, contact the public health department, and we then can procure a kit to test the patients, which may be available from Quest Labs or LabCorp. We do try to keep patients out of the ER. If a patient comes in that I suspect, we are testing oxygen saturations if they're dropping below 90. If I suspect on an auscultation examination that they have Ral's rhonchi or wheezes, they may require an X-ray or a blood test or a test for the influenza. I try to keep them out of the emergency room hospitals, and I will refer them to a radiology department, for example, Hanford Imaging or Fresno Imaging, Advanced Imaging, California Imaging, somewhere where they can avoid going through the hospital and tying up their services, as well as labs that are not required to go through the hospital lab. Let's see, what else? If a patient does come in, we examine them. We may prescribe Tamiflu, maybe a cough suppressant or expectorant, but strict instructions about washing their hands, covering their cough, not touching their eyes or nose or mouth, especially unwashed hands, social distancing and avoiding close contact with people who are sick, staying home, especially if they are experiencing respiratory symptoms like cough, fever, and if not, then coming in and being evaluated for the flu or COVID. As of this day, even today, we are still giving flu shots, believe it or not. And we recommend that highly for all patients. We are at the stage where we are getting short on PPEs, mostly face masks, and hopefully that doesn't cause us to close our clinic. I don't know how the other clinics are doing. We've had some bad luck with suppliers, even from Amazon or Costco. We've had calls where they've hung up on us and trying to procure the PPEs and masks and gloves. We do have some, and like I said, we hope to not have to close. Let's see what else. We're just trying to help the community and stay open. Hopefully, our hospital will reopen, and we can have more ancillary services from respiratory therapy to radiology to labs and ER, med-surg, skilled nursing facility to admit long-term patients. We're in the process of either being able to accommodate COVID patients that are not seriously ill versus possibly regular patients with regular problems. And that's still to be debated, but we're keeping our fingers crossed that we can open our hospital by next week.
That's great. That would be a tremendous asset, because what people can do right now is come in and you can triage them to determine whether they need a test or not, but you can you don't have the facility to administer it, is what I understand.
Correct. In an emergency, like I said, I have called a public health department, and we can procure a testing kit. We have had health updates strongly encouraging not to test populations that are low risk of being infected, and trying to save those kits for the seriously ill patients in the hospitals that need it or may be needing hospitalization or intubation, along with the low numbers of ventilators. I did look into that Abbott quick COVID-19 test, and I have sent emails to Abbott to try to procure a machine. I am aware that it is for single use, takes about 15 minutes. We may not be able to run large numbers like hospitals or other facilities, but in the long term, my goal is if anybody wants to get tested, I would test them. I think at some point everybody probably will need a test for it. But at this stage, like I said, with the low supply of kits, we're not testing, and we're trying to minimize it to a seriously high-risk patient that we can test and maybe avoid hospitalization or being on the ventilator, like this patient that I gave an example of, the RN. If we did have somebody that I suspected was critically ill, as you mentioned, I would call the EMT, paramedics, let them know that we have a possible COVID, so they come in with their proper PPEs, and transfer the patient to a higher level of care, Hanford or Fresno, for hospitalization and intubation if required.
That's great. So one of the questions that we have is, why are we telling people not to test unless they are more vulnerable? And that answers the question, which is the limited testing kits that we have available are, I assume, are to be utilized on the highest risk patients.
Correct. And this new kit that's going to be coming out from Abbott, the quick COVID-19 test, I guess there's only 5,500 machines that are going to be released. So those kits are probably more suitable for outpatient type of clinics like ours. I guess they will probably be using them in hospitals and places where they can do larger numbers. But that would be my goal at some point if I did procure the machine to test everybody that wanted it or required it. And but at this stage, we're not there yet.
Well, thank you very much, Doctor, for being available to tell us how people can access services in Coalinga and in the surrounding area, and for all the work that you're doing to really triage people and have them feel welcome to come in and to separate them from your usual patients as well. I think that's really important. People need to know that if they're going to show up at the doctor's office, they're not going to be sitting next to someone with that suspects they may have COVID-19. Thank you very much. Next, joining us is Ms. Karen Paolinelli, who's the Chief Executive Officer at Madera Community Hospital, and Dr. Terrence Mcgovern. Thank you very much for joining us here at this town hall. If you could please tell us what you've done to prepare for the coronavirus outbreak, and what should residents in Madera County do if they feel sick and want to know if they have the virus, and who's being tested to see if they have the virus, and what's your status in terms of your personal protection equipment, the PPE that we've been talking about. Welcome and thank you.
Hi, thank you very much. My name is Karen Paolinelli, and I do want to just say thank you for allowing me to be on this call, and I do want to also thank our Madera County Public Health Department for working so hard and as a community safety agent and as a partner to us. We've really appreciated all the partnership that we've had. And I want to talk about a little bit just about our clinics and access to care during this COVID pandemic. Many times we're finding a lot of doctors' offices are closed, and we do have a hospital, of course, here with an emergency department that's open 24/7. But we also have our rural health clinics, and we have one in Chowchilla, and we have three clinics on our campus. One is a family practice that we're still doing appointments if need be. We have those opened also in Chowchilla. We do urgent care in Chowchilla as well. And in Madera, we have a rapid care clinic that's open from 8 a.m. till 11 p.m. Monday through Friday, and on weekends open from 8 to 5. We just want to make sure people do have a place to go if they still need care. And, of course, if they're worried about their symptoms, we prefer that if they have a cough, fever, shortness of breath, that they call prior and let us know that they're coming in. But we at all of our entrances in the hospital, we're screening people for those symptoms and making sure that we put a mask on them right away and put them into a room if they do have symptoms of COVID. I want to say that besides our clinics being able to get seen there, we do have our specialty clinic that we have 23 different specialists there, and they are still seeing their patients as needed. We're trying to do only essential visits that need to be done in all of our clinics because we're trying to keep people at home as much as possible. And we do have telemedicine available in both our specialty clinics, our clinics in Chowchilla, and also here in Madera. And so we're trying to give that access to care because we're finding people are not getting their medications refilled, and maybe, their diabetes not in check because maybe perhaps their doctor's closed. So we just want to let you know that, those services are available on our campus, and we're more than happy to see patients. A couple of the other things that we're doing is that we do have our emergency department here, and we are doing testing. We have outdoor testing, and we do have a little process at the hospital where you pull in the parking lot, you call a number, our nurse gets ready, and then she comes out in her protective equipment and gear and you pull right up to the front, and she does the test for you, and then you can just drive away. For that testing, it has to be approved either by the health department or by our infectious disease doctor here at our hospital. So we do have a screening process that we do require, because as the other person participating on the call said, we have a shortage also of the test kit. So we are opening up our testing center and drive-up testing in Chowchilla, because we do know that there's nobody in Chowchilla doing the testing. And again, that those same criteria will have to be met. Either the health department approves it or our infectious doctor approves it, so that we can conserve those kits and only use it for the high-risk patients that really need it. And that the Chowchilla drive-up will start on Monday. And so we're set there to do that. Madera Community Hospital, as far as the surge, we are a 106-bed acute care facility, and we are surging our capacity to about 200 beds here. And so we've done a lot of work internally. We have our command center opened here, and every day, we're meeting with local partners, the California Hospital Association, California Department of Public Health, and just keeping a pulse on what's happening in our state and where we might be needed. We really are struggling, just like all other health entities, on trying to get personal protection wear for our employees. We're running low on masks, and we've had a lot of community outreach, and we've had a lot of great community businesses donate some of their masks to us. So we've been very, very fortunate for that community partnership. But it is definitely a concern, not just of ours, but of all hospitals throughout California and locally as well. We do meet locally with our Fresno regions, and so that we can come up with plans on how are we going to work together if there is a surge of patients. The state of California is expecting that surge to happen around April 23rd. We don't know for sure if that's when it will happen, but our hospital is very well prepared for that surge. And again, working with the other local hospitals just to make sure that we're all prepared to help one another in any way we can to serve our communities in the Central Valley. So what I would like to do now is to introduce Dr. Mcgovern. Dr. Mcgovern is our emergency department medical director. He's board certified in emergency medicine. He's also got a master's in public health, and he's going to talk to you a little bit about what to expect if you do come to our hospital and to our emergency department. Okay, Dr. Mcgovern.
Hi, everyone. This is Dr. Mcgovern. Thanks for having me. I thought it'd be important. Obviously, we've been talking a lot about people staying at home and treating themselves essentially with symptomatic care at home. But if you are feeling ill enough that requires you to come to the hospital, I thought it'd be good to shed light on kind of what to expect if you were to come to the ER here in Madera. And honestly, a lot of it probably carries over to a lot of the surrounding local hospitals as well. Obviously, this is definitely an anxiety-provoking experience for us in the healthcare industry, providers, doctors, advanced providers, nurses, techs, janitorial staff, everyone really in the hospital, but also for the patients. Obviously, when you are coming to the ER, it's stressful, and it's definitely a stressful time to be in the ER right now as well. So when you first arrive to the ER, you will likely be greeted at the front door here at our facility and most of the other surrounding facilities, and most of the time given a mask, honestly, for your protection, but then also for the healthcare workers' protection, just in case you do have the COVID-19 virus and to prevent it from spreading within the healthcare facility, because obviously we have a high-risk population in any of the hospitals. Unfortunately, right now we are trying to limit visitors to the hospital, so unless you're a child or if it's an end-of-life situation or someone that you provide most of the care for the patient, it's probably just going to be the patient that ends up coming back into the ER to be evaluated. Your first stop essentially is with the triage nurse. So just like any other ER visit, your vital signs will be taken, and the triage nurse likely will be wearing a mask, and they may be wearing other protective equipment as well, and that is not meant to scare you or anyone that is with you. It is just, again, protect ourselves and to protect you as well. From there, you end up going back into a room that's where you'll be seen by either one of the doctors that's on staff or one of the advanced providers as well. And they'll ask you, obviously, a series of questions, and some of those questions are going to be pertaining specifically to the COVID-19 kind of screening questions, whether you've had contact with someone that is positive for COVID-19, if you've had any relevant travel, either within the U.S. or outside of the United States as well. From there, we'll kind of be dictated about what tests we need. Do we need to get a chest x-ray? Do we need to have blood work drawn? And then if we need to swab you for the COVID-19. A lot of people have been talking, obviously, in regards to resource utilization and the number of tests that we have available. And just like many hospitals, we have a limited number. So we do try to limit our testing to the most high-risk categories of patients that are at risk for having bad outcomes from this disease process. Once we have all of that back, and you'll likely be in the ER for a couple hours at least, and we'll be able to monitor your vital signs and see what the blood work results and chest x-ray results show. And then the decision will be whether it's time for you to be discharged home or if you need to be admitted to the hospital. Obviously, if it's something that we're concerned about COVID-19, there will be further instructions in terms of a home quarantine at home for the time frame, and your doctor will talk to you more about that at that point. But obviously, it's a very stressful visit to the ER anytime, but it's definitely even more so now because it is just a high-stress time with all of this going on. So I hope that provides a little bit more background on what to expect if you do end up having to come to the ER for any care.
I think that's very thorough. I really appreciate that. And what's important is that because you want to reduce the number of people that are coming into the hospital, you're likely to come in by yourself. And if it's determined that you have the virus, visitors are not encouraged. I'm from a big family. We all go, when somebody's in the hospital, we all troop in to say hello. You don't want people to be bringing in all of their family members, is my guess.
Yes, we absolutely are not. We have restricted all of the visitors that are coming into the hospital, except for those exceptions that Dr. Mcgovern spoke about. So, yeah, it's very tough for us, too, because I'm very much a patient advocate, and I want people to come in. I mean, my family's that way as well. And so this is difficult for hospital personnel as well because, you know, sometimes family members want to be here and we can't let them in because it is COVID-19. And that's to protect our staff, our patients that are vulnerable, and also the person that wants to come in. They don't sometimes realize, you know, that they could be putting, you know, others at risk. So we've limited really all the people that are coming through our hospital, whether it's a vendor, whether it's a patient, whether it's a vendor, whether it's a visitor, or of course patients can come in anytime. So, but everybody is screened at our door. So
that's great. So there was a question that was asked regarding whether there's a tracking once people are sent home. Is there welfare checks or monitoring or anything else that to ascertain that people are okay once they go home? Many times people live by themselves. I think that's the concern. Do you know if the counties or the hospital is monitoring or following people afterwards?
Sarah, do you want to answer that?
Yes. So if an individual is diagnosed with COVID-19, they are receiving daily phone calls from our team at this time. We still have resources to be able to connect with all of those individuals on a daily basis, check in and make sure that they're feeling okay. If their symptoms are worsening, then we work with the hospital to be able to have them go in and seek medical care. Individuals also who have been close contacts of confirmed cases are also monitored on a daily basis to make sure that they have everything they need. It can be difficult, as much as everyone is having a hard time with staying at home. If you're actually in isolation or quarantine, it's more restrictive, and so you can't go out for essential business. So we check in to make sure that they have everything they need, see if anything needs to be brought to them in order to stay in quarantine and isolation, and also to check to see that if they didn't have symptoms before, are they developing symptoms and need to have a bit different approach to their care and need to be tested.
Great. Thank you for that. I think that's real helpful to know that there's some follow-up, and that if there's a need develops, that you'll know about it. So that's much appreciated. Well, that concludes our participants. I'm going to move on to our Assembly member, Dr. Joaquin Arambola, who has not only is a tremendous Assembly member, but also is a medical doctor, and so has some real good experience. Dr. Arambola, thank you for joining us on this town hall. You wanted to make some comments as well.
Thank you, Senator Caballero, and appreciate being a part of this. During these times, I think it's always important for us to be presenting facts, as so many people are fearful. And I have enjoyed the discussion that you've helped to provide from various people within the healthcare industry. I did want to speak a little bit about some of the work that we're doing at the Assembly. And then, if I could, talk about a new role that I'm trying, that I will be working on, that I believe will coincide and be able to help many of the people who are on this call here today. So, first off, 2.5 weeks ago, we invested nearly $1 billion, and many of that funds are starting to go out and figure out ways to be helpful. And yet those funds are not helping us to alleviate real issues for people every day. And I think that much of what actually needs to be done now is preparing for the surge capacity. What we've heard from Madera Hospital regarding their ability to increase their bed capacity is truly amazing. Our ability to prepare and to get ahead of this curve should help us to save lives in the long run, and will allow us better time to prepare. We faced pandemics before, and that's not to minimize them, but to share with the public that we have plans in place and we have protocols and procedures that we run for just these types of scenarios. Now, more recently, I have gotten quite involved in trying to make sure that we have all of the resources that are needed on the front lines. So both the discussions regarding personal protective equipment as well as staffing and surge capacity are issues that I'm putting front and center before me. The Speaker, who is the leader of our Assembly, has asked me to be the liaison with the Governor's office and have been interfacing with the Office of Emergency Services to help to relay what I'm hearing on the front lines. Your comments here today have been recorded both by me as well as the Senator, and will be quite helpful as we start to advocate and attempt to return many of the things that you are asking for here today. And I do and am very acutely aware of that fear that was spoken about for our frontline providers who are not adequately taken care of right now, and look forward to making sure that the call to action that the Senator is doing is heard loud and clear, and that we provide support as we can to those who are on the front lines. Having been a frontline worker, a first responder, I am acutely aware of the sacrifice and have a tremendous amount of gratitude and appreciation for all of you who are exposing yourself in an effort to serve and to protect your community. And so I appreciate being a part of this call, and just wanted to thank the Senator for allowing me to participate and to share a few words.
Thank you so much, Dr. Arambola, and we really appreciate you being the point person for the Assembly. As you know, that we have two separate houses, and we work very closely together, and I look forward to continuing to work with you both in my role as the Senate, and then also representing the exact same district that you have. Thank you so much for all your hard work and for joining us here today. I understand that Dr. Vohra may be on the line. I'd like to give him an opportunity. He is the interim Fresno County Public Health Officer. Welcome, Dr. Vohra.
Thank you so much, and I apologize for the technical difficulties. I appreciate
technology is great when it works, and I'll tell you, when it doesn't, it's frustrating. So welcome.
Thank you. I appreciate having the chance to just to share our role here in Fresno. As you know, we've stayed very busy, just like our colleagues and counterparts throughout the Central Valley. And, I really just want to echo the camaraderie that the Assemblyman has been able to really celebrate, because it's been very heartening to see everyone come together as a community and really think about what are our vulnerabilities, what are going to be our potential problems, what are our resources, and how can we all work together and collaborate. And while we are very concerned about the numbers that are increasing and the potential surge here in the Central Valley, but also the surges that are going to most likely happen in other parts of California and then affect, the supply lines and really the whole medical infrastructure throughout California, I feel optimistic that we are going to meet this challenge if we rise to the occasion. I can tell you right now that we're very, very much trying to message that the social distancing is really going to be the best and only shot that we have at flattening the curve, and everyone needs to take that extremely seriously. And that's something that whatever we can do to get the public on board and really recruit as many people as possible to maintain that social distance and do all of the other things that we've talked about today, about the hand hygiene, and really now masking in public and making sure that they know how and why a mask should be used and in what circumstances those masks are helpful, and then all of the ways that they can be doing, just taking little steps to prevent passing on this germ or catching it themselves. These are all important things that the whole community needs to understand how to do, and then just to start doing them immediately. So those are all the kinds of things that we're really focusing on here in Fresno. We're also very frustrated by the testing situation. We're hoping that it gets better and sooner rather than later. So we're doing everything we can to ask those hard questions and make sure that our state partners as well as our local stakeholders here can actually achieve a higher testing capacity week after week. And finally, we're actually doing the modeling that we need to be doing to anticipate the increased volumes and the surge that we know is coming with this illness. We obviously want it to be delayed and minimized as much as possible, but we're harboring no illusions that our region is going to be hard hit, and we want to make sure that we're as prepared as possible.
So I have a question from the mayor of Firebaugh, and he asks whether Firebaugh is being considered as a testing site in Fresno County.
Yeah, well, we actually are working with all of the medical providers throughout the counties and just making sure that they have the best evidence for making the selections for who gets the test. Because obviously if someone is very symptomatic and they need to know whether they have the COVID-19 or not, that's an important person to prioritize. But I think as one of our other speakers said, it's really important to make sure that we select people who have a high risk of complications because they're frail or elderly, or they have predisposing conditions, or they have a high risk of passing it on because they're working on the front lines or that they're working in healthcare. So that's kind of how the CDC, the Centers for Disease Control and Prevention, are guiding our selection criteria. And that's kind of what we're recommending is, those are the folks that need to get tested on a priority basis. With all of our communities, including Firebaugh, certainly we want our medical providers to use that evidence-based selection criteria to make sure that they're testing the right people because it's such a limited resource at this time.
Got it. Understood. And I guess there are some ballot measures that are being circulated for signatures, and the question that's asked is, will there be extensions of time contemplated for ballot initiatives that are time sensitive? This is new to me, so do you know anything about ballot measures being circulated?
Myself?
It would be, during the election process. If
sorry, I'm certainly not an expert about election timing, so I'm going to defer that one to someone that has more knowledge about that than I do.
I understand completely. And it's really a local question because there must be somebody that's working on a ballot measure, and those deadlines are usually pretty certain. And so we'll see if we can get the answer another way. But it hasn't come up on the radar screen for a public health issue. So we'll look forward to finding that out from the elections department. Great. Well, I think you answered all the questions that were sent in to us earlier. Thank you so much for getting on the phone and joining us here today. It was important to hear from your office and from you in particular as well. The message is loud and clear. Everybody's working together to do everything that we can to be able to get more testing, more PPE, to make sure that we have the resources we need as we move into the expectation that our numbers are going to go up, the surge, as they say. As I said, we had questions emailed to us prior to the call, and many of them have been answered. If we didn't get to your question, this won't be the last town hall that we do. I want to ask you to stay in contact and let me know what information we should focus on next. We're nearing the end of this scheduled call, so I'd like to thank all of the speakers who joined this evening. You are our community heroes. Your community thanks you for helping to keep us all safe. And I also want to thank Assemblymember Dr. Arambola for his important remarks and for his incredible work to bring resources to the Central Valley and to really try to improve the healthcare services that we all want and deserve. And as a footnote, we're working very hard to try to expand the opportunity for UC San Francisco to expand their medical school into the valley. It has started already, but there needs more support for students to be able to go to Fresno State and UC Merced and be able to get their medical license while they do that. We're very excited about that. So at the beginning of the town hall, I said that my first priority was your personal well-being and that of your family members. And that's my pledge. But I can't do it alone, and it takes your cooperation with the shelter in place or the stay-at-home order that you heard all of the doctors talking about. It is your commitment to vulnerable members of the community, and if we can protect them, then we'll do a better job making sure that they're safe. But we need to do this together. And as your senator, I'm committed to action. I heard loud and clear over the past few days that first responders and medical providers need supplies to keep themselves safe from the virus. So I'm looking and asking for donations. Medical offices such as chiropractors, dentists, and surgery clinics may have medical supplies and personal protection equipment that they're not using and can be donated. Carpenters, electricians, and people who work in the construction trades or are in the trades may have masks and face protection equipment as well. If you have any of this equipment in its original unopened condition and would be willing to donate it to help our healthcare workers, please call my office at 209-726-5495. It's listed on social media, 209-726-5495. And we can arrange a pickup. And you can also email my district director, Anna with two N's, ANNA .Velazquez, VELAZQUEZ at sen.ca.gov, sen.ca.gov. The audio of this town hall will be posted on my Senate website and through social media soon. If we all work together, we can be better prepared to fight this grave disease together. Additionally, if you want to make a donation and take the donated items yourself, you can drop them off at Kerman City Hall, the back entrance to City Hall, located at 850 South Madera Avenue, Kerman, California. Again, that's Kerman City Hall, 850 South Madera Avenue, Kerman, California. So a big shout out to the city of Kerman who made themselves available to take in these supplies. These are critically important. And so we want to call to action. Thank you very much. And thank you very much for joining us here tonight. This concludes our town hall broadcast. Be safe and stay healthy. And thank you so much.
Thank you.
Thank you.
Thank you, everybody.